Thank you. Can you hear me? My name is Aura McQueen, and I'm the Minority Outreach Educator at Planned Parenthood of Mid-Iowa. In my job, I take family planning information and sexually transmitted disease, including AIDS education, to the at-risk community. This is the low-income white community, the African-American inner city community, Hispanic community, the Asian Pacific community, Native American community, the gay and lesbian community, and anyone else who needs me. I do education at churches, at schools, on the street corner, in nightclubs, wherever I'm called and they need AIDS information. And in my national position as a national faculty of instructors, I'm one of 3 people from the state of Iowa, 2 being out of Waterloo, and I'm from the Des Moines area. There were 16 of us appointed across the nation, so I feel honored to represent Central Iowa. We were appointed by the National American Red Cross to do training for trainers who work with African American youth and families. Next spring, they're going to be rolling out with a Hispanic course. In the Red Cross, they call it a rollout. I'll probably be sent to the Dominican Republic shortly after the first of the year to do some training in that area. Also, about early 1992, they'll be doing an Asian American rollout. And we call them rollouts because the people, as you will see in some of the information that we have, people of color sometimes are most affected by the devastation of the disease. And we're trying to give special attention to some of these groups. And that's kind of to give you some background on what I do in my job. And today, in honor of World AIDS Day, the World Health Organization and CDC, the Center for Disease Control in Atlanta, this is the 3rd annual World AIDS Day. And because of the rising rate in AIDS with women nationally, they have designated that this World AIDS Day should be an education and awareness for and about women and AIDS. Nationally, since December of 1989, the rate has risen by 300% in the United States of women infected with AIDS. When I got ready for our World AIDS Day, which we held in Des Moines on November 29th, I thought maybe the rate probably had doubled in Iowa because we have such low numbers that are reported. In doing the research, from 1983 until November 1990, Iowa has risen by 600% in terms of the number of females that have been infected with the HIV/AIDS virus. Then I looked at my statistics from December of 1989 until November of 1990. We have quadrupled in Iowa, which means that we have low numbers, but we are above the national rate in terms of the number of females that are being infected with AIDS. And we need to be aware of that, and we need to be concerned, because when we look at the number of females that are infected with AIDS, this means that children, if there are women in their childbearing age, children are going to be infected with AIDS. Of women in childbearing age, 15 through 44 years old, in the state of New Jersey and New York, it is the #1 killer of women in childbearing age. And I'll repeat that. AIDS is the #1 killer of women in childbearing age in New York and New Jersey. Nationally, it has risen to be the 5th killer of women in childbearing age. We need to be concerned. If in Iowa our numbers are low, we need to keep them low by continuing to educate and give people information and make them aware of the spread of AIDS. I received some information a couple weeks ago from the Center of Disease Control, and I talk to people in the AIDS education field, and when you get to be an AIDS educator, you get gung-ho, and you get really excited and overwhelmed. So when this information came to me from CDC, 1 child per day in the United States is being born infected with AIDS. This means that if we look at statistics, it says 60% of the women infected with AIDS who give birth to a child that 60% of those children will have AIDS. If we're talking about 1 baby a day in the United States being born with AIDS, we're talking about almost 700 women if statistics prove to be true. There's a lot of stigma surrounding AIDS, in particular with women in AIDS, stigma and homophobia. When AIDS first came out, it was labeled as a gay disease, and if you weren't white, homosexual, you were not in danger of AIDS, okay? In the homosexual community, they are politically organized, they are socially hooked into institutions in the community. They have moved on to do something in terms of educating and the infection rate and the medical treatment around AIDS, and it's being a lowering in their rate. So in other words, they're kind of out there in terms of doing something within their community about AIDS. When we were trying to recruit women for our panel of discussion with AIDS, we could hardly get anyone, any female that was infected with AIDS to come forward and speak. One, there's a lot of blaming. If a woman has AIDS, she was likely a prostitute, or if her child was born with AIDS, she gave AIDS to the baby. Then in our society, we are supposed to be the shining stars, the mothers in the homes, we do the community work, we keep the children in school, we keep them from going delinquent, we keep the marriages from going bad. These are the burdens that are placed upon women by society. So in other words, we're supposed to carry on all that. There's nothing negative or supposed to happen to us. So therefore, if a woman gets AIDS, it's sort of her fault. You understand where I'm coming from? So in light of this, it's a lot of stigma, hostility, women suffering from low self-esteem, from shame, and not being able to come forth and speak out about AIDS. When it comes to protecting a woman, when it comes to protecting herself from AIDS, many times women don't feel empowered. They may be in a relationship where they have a sexual partner who is unwilling to help them to protect themselves. If they're in a heterosexual relationship, maybe the only thing standing between them and a death sentence, and AIDS is still a death sentence because there is no cure. Maybe the dependency upon a man to use a condom. In many relationships, women are abused. Across the United States, 4,000 women a year die from being abused by a spouse, a significant other. And if a woman is already in an abusive relationship and she's trying to get someone to protect her by using a condom, sometimes this may bring out anger, will make further abuses toward her. And sometime at that point, rather than to be abused, maybe a woman would not insist on being protected. We're seeing the rise in rates now, and about 56% of the rise is due to IV drug usage, either on the part of the female herself or a partner who is an IV drug user. And as we hear more and more on the news about drugs and AIDS, there is some direct and indirect links between drugs and AIDS. In the Des Moines community, and I'm sure you don't have street gangs in Ames, right? Do you? Okay, in the Des Moines community, we have a problem with street gangs. And for the last couple of weeks, I've been working in a situation that both in the females and male gang members, when you join in a gang, you have to bang the whole gang. Do you know what I mean? In other words, you have to sexually be with everybody in the gang. We have kids turning up in Des Moines with 4 and 5 different sexually transmitted diseases. Maybe they are not positive with AIDS now. Over the next 5 to 10 years, these may be our new AIDS patients. Also, and I laid that ground to talk about drugs, many of the gang members are involved in drug sales. And in selling drugs, unless you own the boats and the planes and the trains that bring them in, more than likely, if you're a little guy on the totem pole, you're not only selling, but you're taking, and more than likely, taken to cover your drug habit or to support your drug habit. These young men are also selling sex, selling their bodies in exchange for drugs. We have 45 cases of strain-resistant gonorrhea in Des Moines that penicillin is not helping. 95% of those that were infected with the strain-resistant gonorrhea are young males in the inner city area from 12 to 30 years old in the zip code area 50314. And the health department had linked them to the gang and to the drug-using community. Now, they weren't shooting drugs to get, the infection. Many of them are selling their bodies. And when you talk to these young men, they'll tell you who they're selling their bodies to. They're selling their bodies to the middle-aged man, young to middle-aged man, who comes from Urbandale, from West Des Moines, that wear the double-breast suit and drives the Jaguar. So you know who I'm talking about. So not only are the kids in the gang in the inner city area maybe the future AIDS patients of tomorrow, we may be talking about a suburban outbreak of AIDS. I also, because I'm on a college campus, I also want to mention, and I have a pamphlet that I brought. There are several brochures on the table. But there was a pamphlet that appeared in Focus magazine this year, March 1990, and called AIDS Prevention Challenges for Colleges and Universities by Dr. Richard P. Keeling. And I understand that he has spoken on the Iowa State campus before. And I really trust Dr. Keeling's information. And in his article, he points out that there was a blind study done with 17,000 college students. And in that study, 2 in 1,000 college students is HIV positive, or are HIV positive. I have another study that I couldn't find, but I'm going to provide to the medical staff here. It said 1 in 300 college students in a study that was done, and I'm not real sure what area it covers. It's been a while since I read it, but I do want you to have that information. 1 in 300 college students is HIV positive. Sometime when young men and young women grow up in our society and to leave home for the first time at 17 or 18 years old and come to college is a time of freedoms. 1, the freedom to drink. 2, the freedom to have sex if you want to. Okay? As an educator and as a mother, I'm the mother of 2 college students and a high school student. It would be our wish as parents that you would wait and abstain from sex until you get into a relationship that is going to be lasting, mutually monogamous. But sometimes the wishes that we as adults and parents have may not be the same wishes or the situations with our children. and we may have to accept and live with some results that we don't necessarily like. In other words, it's a struggle being a parent. But if you, in sexual intercourse or sexual activity, and drinking too is by choice. The laws say that you're in possession of an illegal drug if you drink alcohol before you're 21 in the state of Iowa. That's what the laws say. But there again, to drink or to have sex is a personal choice. But I would advise you that if you are going to have sex, have the good sense to protect yourself. Right now, the only protection that we know is the condom. And I know college men don't do this, but when I work in the high school, the guys in high school say the condoms don't fit them. They are too well endowed. And sometimes in working with the brothers, and do you guys know who the brothers are? These are black guys. They're hung like horses. The condoms don't fit them either. But I take and I put my fist into the condom. The high school guys and the brothers too say we're bigger than that. Okay, that's fine. And if I don't hit this with my fingernail, okay. If both fists fit in the condom and you're bigger than that, you don't need sex with a male or a female, you need surgery. And I did that demonstration because many times young men have young women, or if it's a partner, if it's a relationship in which there are two men in a relationship, that the condom is too small, it doesn't fit. I did forget my Magnum condoms. There are some Magnum condoms on the market, but when you look at those things, they don't fit anybody, not even a horse. I also have another one that, now this one's FDA approved. I have another one that is still being approved by FDA. It's been tested and thought to be safe, but because it's extremely expensive, FDA has not released it to the public. This is a female condom. How many of you have seen a female condom? Okay, it's called a WP33. It's made by the Wisconsin Pharmaceutical Company out of Wisconsin. And this slides up and down. I'll pass it around and everybody can look at it when I'm done speaking. This is a loose loop in here. Anyway, this inserts in toward the body cavity. I'll turn it to the side because this is flexible and it fits inside of the body, inside of the female body. Once it's turned loose, holds it in place. This extends out over the lips of the vagina, and the moisture of the body is supposed to hold it in place. Now, is everybody in here an adult? I forgot to ask that. This isn't pornography, but this is another kind of, it brings up conversation. We use it for educational purposes. But shortly after the first of the year, we're looking for FDA to approve it. This costs $1.44 as compared to the average cost for a male condom is 50 cents. So they're trying to make it economically and cost effective. And I'll start passing it around and you can look at it. It's okay to touch it. It's not nasty. It hasn't been used. Sometimes, because AIDS is such a devastating disease in terms of we know that there is no cure, sometimes we can get real serious, which we should be. We can be forlorn and we can be sad about it. But sometimes things that are painful and that we have no answers for, we have to put some soft touches and sometimes laugh, in other words, laugh to keep from crying. And I work with a lot of young people, and if I can get their attention by showing and working with them something that will laugh or soften them up to the point where they will listen to the messages about AIDS. When you're working with young people, there's two things. One, there's a war zone, and if you're not careful, they will pull you into the war zone if we don't work into it ourselves. And we do that as adults because we are the authority. We preach down to them. We have all of the answers. We never ask them their wishes or their participation. We don't care what they think. We've got all of this information, and we can do things for them, not let them help us plan for them, okay? On the other hand, sometimes a young person is just waiting for an adult to make an authority move where they can start the war. And so in other words, when the war starts, sometimes we can't get through with communication. The young people cannot communicate with us, nor can we with them. And when we talk about sexuality and AIDS information, we as parents, we as educators, we as people in authority, as counselors, medical people, we need to be open where people will feel free to talk to us about their concerns in regards to social disease and to sexuality. And sometimes that isn't always easy. But let us not let things such as the war zone keep us from communicating. There's one thing that AIDS has done for us all. It's made us come public and talk about sexuality. It's no longer left in the closet. It's no longer left in the bedroom. We have to talk about sexuality. I know there have been some communities in Des Moines in which sexual education has not been approved in school. Iowa has mandated it, and we have a human growth and development manual that is being used in the school system. This information is written very general and very conservative, and I can say this because I'm a Democrat, but I'm not here on a political campaign. But in other words, it was written as such where we could get it past the governor's office and at least get some sexuality information in the school. Now, it doesn't say how much sexuality information that a student should have in school. It doesn't mandate that. We're finding sometimes in going in and talking with students that they have had maybe 1 hour of sexuality education throughout the whole school year. So I think we need to be concerned, and if there's anything that we can do in our communities to promote sexuality education, drug education for kids. Our kids are at risk today. That doesn't mean that the black kid is more at risk than the white kid or whatever. All of our kids are at risk. If we have a kid that is at risk for becoming involved in drugs, we're also talking about a kid that's at risk for dropping out of school, also at risk for becoming a street gang member, also at risk for having 1/2 the earning power of an adult who is a high school or college graduate. Our kids are different than we are. I see the young people being brighter today, but at the same time, I'm getting to the close of my time, so I'm gonna wind this down. At the same time, these kids are in a computer age. They see life come in instantly by computer, by the satellite television. Many things are happening now with young people that make them brighter than we were when we were younger. And the way we communicated may not be the same way in which we communicate with young people. Maybe we might have to show them a film. We might have to do some kind of a television program or something. But let us get the words out to our young people. These are the kids, and I would take the language back in terms of kids. The youth and young people are feeling they're young, they're invincible, they're gonna live forever. AIDS does not happen to them. It happens to the older people, to the adults. But we have to let our kids know if they're sexually active and not protect themselves, that they are at risk too.
I'm Jean Youngclass. I'm from Des Moines, and our son just died May 29th from AIDS. He was a hemophiliac, and I will give you a little bit of the background. We have no hemophilia in our family. I have none in my family. It comes through the female line. But it can skip 13 generations. It also can be due to a mutation in the genes, so we really don't know how Dick happened to be born with hemophilia. He also was born with a natural circumcision, so we were not even aware of this until about 3 months of age, when he started rolling over on toys and would get large hematomas on his ribs, and he would get spontaneous bruises all over his body at times. And then other times he would seem very normal. Then as he started crawling, his knees would swell, and he would just scream in pain, and we thought, we didn't really know what was happening. The doctors didn't know what was happening. Today, I'm sure we would have rushed him to Iowa City or to Rochester, but that was 37 years ago, and we just didn't. We kind of rode it out. And he was about a year and a half old when they decided to do a bone marrow on him, and I was so naive, I didn't realize what the significance of that was. I just knew that this child had something terribly wrong with him, and that the times of pain and swelling and bruising were very frequent. And the bone marrow was done. The doctor called me on the weekend while I was teaching. I teach privately, and told me he didn't want to worry us, but he thought Dick had leukemia. And I immediately collapsed. Our family doctor was out of town. I had no consolation during that weekend. My husband came home. We didn't know what to do. Every time I looked out in the yard, this little guy running around in his red snowsuit, I thought he won't be here next year. But when we finally were able to talk with our doctor, he said, "Oh, I'm sure you would be dead by now if he had leukemia," because that really was a death sentence in those days. So we kept still wondering what in heaven's name this child had. And in the spring then of 1955, I believe it was, or 56, he had a severe knee hemorrhage, and we took him to a bone specialist who drew blood from his joint, and it was diagnosed definitely that it was hemophilia. We then took him to Iowa City, and that was a really good experience because we were helped to understand the significance of what this was, what it would do to our lives, what it would do to his life. He was a classic hemophiliac. He could never do any sports, no contact activities at all. He could not ride a bicycle. He could not roller skate. So he had to learn to find other interests in life. And both my husband and I are musicians, so that we could see that there were a lot of things in this world other than sports. But it was very difficult. The kids gave him a really rugged time as he was growing up. He had many really serious hemorrhages when he about died. The year before he started school, he had a colon hemorrhage. He vomited blood. We had to rush him to the hospital, of course, each time. And we found out there was a plasma we could get from Chicago that would really, that was much better than anything that they had in Iowa at that time. So we would have the plasma flown in, and we had a lot of exciting times with the plane landing or leaving it in the wrong airport, and fog interfering with getting it down. We had to have it relayed by the highway patrol a time or two down to Ottumwa so that we could have the blood. They finally kept it there in Ottumwa, so we had the special plasma. But it was a real agony, and as Dick started kindergarten, my husband said, "Well, why don't you start some organ lessons?" And that turned out to be my sole salvation, so that was really a silver lining amidst all this adversity, because found out I could be in my own world and this is still an exciting part of my life. In fact, the day that they called to say that Dick had died, I was at the organ practicing, and I was playing a piece of César Franck's Pièce Héroïque, and I thought, how neat, because Dick really was a hero. Our church is purchasing a new organ in the near future, and my first dedication recital will be to the memory of Dick, who was a musician also. And Pièce Héroïque will be one of the pieces on that program. So that has been a real positive thing that has come out of this struggle that we had with the hemophilia. In 1965, we learned that there was a new factor being made, and so we took him to Michael Reese Hospital in Chicago and learned about factor VIII, and that was a miracle drug. Dick no longer had to miss 3 or 4 months of school a year. He didn't have to suffer the pain for so long, because when factor VIII would contact his blood, he would start coagulation and he could get relief. And so then he became active in school. He was a percussionist. He was very active in drama. He was very active in the art world, and was able to have a very fulfilling life regardless. Factor VIII is platelets that are spun from your blood and my blood. They can use the blood for other things, but the platelets are given to those patients that need them, people with Hodgkin's disease, leukemia, and hemophilia. And while we thought it was such a wonderful thing, I've learned afterwards, in fact, when we were in a support group at Mercy Hospital, with some information we got from Mercy, that in each unit of factor VIII, there can be from 1 to 1,000 persons' blood. Dick would have to have 30 units at least to stop a hemorrhage. And so if he had 10 hemorrhages in a month, why, it's inconceivable how much blood had touched his blood, of other persons' blood anyway, since 1965, when he was 13 years old. So it's inevitable that anybody that has this factor and has had it before 1985, when they were testing the blood like they do today, will probably be HIV positive, will probably die of AIDS. I still am grieving a lot. His birthday anniversary just passed in October. Thanksgiving was tough. I know Christmas is going to be. The message I guess I would like to really leave with you is that you can protect yourself. You can know how to protect yourself if you're doing risky behavior. And for heaven's sakes, do. It is a dreadful disease. Dick was diagnosed ARC, which they don't call it anymore, it's just HIV positive, in 1986. He had come back for his sister's wedding, and amidst the joy of the wedding, we had the trauma of Dick telling us, I have AIDS. And it became full-blown AIDS in December of 1888. And he had to quit work. He was a computer programmer at Henry Kaiser Hospitals. He had just had his 5th promotion. He was just in the prime of his life. And it hurts to look at people that are his age. And he had so much love of life, and he was so courageous. So, if you can protect yourself, please do. He had no choice. He had to have blood to live. Thank you.
I guess my situation is kind of similar to Jean's, except for it wasn't my son, it was my brother. As it was said earlier, he died in January of 1988. He was just short of his 19th birthday. Being a college student here is very difficult at times. He'd be 22 this coming February. He's about the age of a college student. He could probably be any one of you. But he was born in 1969, and hemophilia was something that we knew was part of my family. My mother was the carrier, and so we knew from the outset when he was born that he was a hemophiliac. And unlike Dick, Vernon wasn't allowed to have the factor VIII until he was probably 5 years old. It didn't reach the Omaha, Council Bluffs area until about then. And it was a miracle. We spent a lot of time taking him to the hospital. He spent a lot of time in the hospital just for minor hurts that for a hemophiliac is so aggravated. We think nothing of falling down and cutting our knee or our elbow or any other part, but for a hemophiliac, it's very serious. You just cannot stop it. And with the factor VIII, treatment could be done at home. My mother learned how to give him the injections that he needed. You know, and you pretty much learn to deal with the difference between your brother and the other boys. You know, they can't have the major contact sports, no football for him. He did turn to drawing. He was fairly good at it. And then they started talking about AIDS, you know, and you sat and you worried, and we tried not to discuss it. We didn't want to think about it. You don't want to even consider the possibility that you can lose somebody you love, especially when they're young. But eventually he started exhibiting some symptoms, such as not eating. He probably shot up about 6 inches in height, but he gained no weight. And it's kind of frightening when you're about 5'6" and you weigh 115, your brother's 6 foot tall and he weighs the same thing. Makes you feel fat. And it progressed from there. His asthma kicked in, it went to bronchitis. We took him to Iowa City. I think they found the AIDS virus, but I can't even tell you right now. There's so many things that just kind of blur in your head. We decided to have him treated at Children's Hospital in Omaha. Iowa City is a very long drive from Council Bluffs, and both my father and I had jobs. So we had him treated by his own hematologist that he'd had since he was 5. And for 2 years, we just watched him go downhill. He lost his memory. He said some very bizarre things. He robbed a bank with the old guy down the street. But he was really serious. And the mental deterioration the AIDS virus had reached into his brain, and it was killing sections. Little by little, they did some MRIs, which are magnetic resonance images, and they showed those spots where there is no brain activity, and there was none in quite a few places. And he had pneumocystis, and you watched that take over, and I was there the day he died, and it was one of the hardest things I've ever seen in my life. I have never watched anybody die, nor do I ever want to do it again. To watch him take his last breaths was just crushing. I did what probably most people would do, I think. I freaked out and went screaming down a hospital hallway, which prompted everybody to come out and say, "So, what's going on?" His friends tried to visit when they could. I had to play taxi cab because about 16 or 17, most parents are not going to let their children drive in Omaha, Nebraska, which is very smart on their part. They didn't know what to say, and it was kind of, they had to try and face their own mortality by watching him. And when you're 16 or 17, you're invincible. There's no way you're ever going to die. And there was my brother, and his friends just weren't quite sure how to cope with it. There really wasn't any community support because we wouldn't tell anybody. We pulled him out of school. We just didn't want to have to go through the same thing that kids like Ryan White had to go through. I admire Ryan greatly, and I was very sad when he passed away. And the Ray children down in Florida, things like that should never have happened. That was just uncalled for. These boys are hemophiliacs. They didn't ask for this. Nobody ever asked for AIDS. It's very frightening to watch. And I've had a hard time dealing with my brother being gone. It's been almost 3 years now. And I still have moments where I kind of crack a little, and And I've been through support groups, and I've seen psychiatrists, and I've thought about committing suicide, which nobody knew until I wrote my opinion in the Daily last October, somewhere in there. It's kind of a shocker for my parents because they hadn't known that. You just and you walk around and you think, don't these people know what this disease can do? I don't ever want to see what I had to watch my brother go through. It was painful for him. It was painful for my family. And you're not invincible. If you do not take care of yourself, you can get this and you can die. And I just hope people think about what they're doing, because at 22 years old or 18 or 19 or even my age, 26, you have a lot of life ahead of you, and there's no reason why you should do something incredibly stupid and end it sooner than it should have.
Okay, I think we'll go ahead and open up questions, so if anybody has any, go ahead.
I have a question for Laura. You said you're dealing with grade school kids too.
Yes, we do education in
Where,
grade school.